You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Dr. Shawn Javid. Him and his son are the co-founders of Smilebody. They're revolutionizing oral health care through what they call biological dentistry. And don't worry, we'll define the term very soon. So welcome, Shawn. Thanks for coming. I appreciate it.
Thank you so much for having me. I'm excited to be here, and it's a Friday afternoon, so that's great. Thank you.
Oh, good. So we're getting him at his most relaxed there. All right. So first question, what is, I know regular dentistry, orthodontist, endodontist, this and that, but what is biological dentistry?
Great question. Just a little background. I've been a dentist in Los Angeles for 30 years. And so the first 15 years, I was just a implantologist. I did thousands of root canals, did a lot of cosmetic dentistry for years. And I took a lot of residencies. Thought it should be the best I can be because I love dentistry a lot. And about 15 years ago, I ran into a biological dentistry conference and I realized, oh my God, I'm actually hurting my patients medically, which kind of blew my mind, which basically in a nutshell, we're going to get more into it, but dentistry just looks at patients in a way that they want to get you functional so you can eat without pain. They don't look at materials that are going to the mouth that cause systemic problems and medical issues to the patient. Almost like your head is cut off from the rest of the body and you're like, just go in like a tabletop, fix it. And the patient, as long as they're not having pain, you're fine. But sure, that's not true. So what happens, metals, we're going to talk about, there's a lot of hidden infection, a lot of root canals that are infected that are not noticed in the jaw, sinus infections. All this stuff is encompassing of, and what kind of materials, like I said, that goes into the mouth that cause systemic issues. So that's biological dentistry. We use biocompatible materials to make sure that what's going in and how we take things out carefully, not to expose the patient. That's what it is in a nutshell.
Yeah, like I have an old filling that's let's see. Actually, she's 35 years old. And I only have one cavity, supposedly when I was like 14. So it's been 35 years and I have like a mercury filling. And I thought, I don't know. I don't think it's leaching after all this time, but, then again, I've heard maybe not. So, I mean, something like that is, certainly not co-biological, it's anti-biological. What's your position on like fillings, for instance, mercury fillings?
That's a great question. And thank you for saying it for what it is. It really is mercury fillings. So unfortunately, when we were kids and we were younger, they would call us silver fillings. There's no silver in it. So it's actually 54% mercury, right? So, and today's world, everyone's trying to, not to have this fish and not to have this and all that. And when people have mercury fillings in their mouth, what they don't realize is that all kinds of metals are bad, but mercury is a different animal of its own. Mercury fillings are releasing mercury vapes in the mouth all the time when you're eating, hot, cold. So little bottles of mercury is always coming, right? Right. Because what as you're doing on it, you can go to our Ballistic Academy, they have a video showing the mercury vapes as you're eating on it because layers and layers are coming off and vapes are coming through, right? Micro layers. And what happens is that there's something called EMF, right? Electromagnetic frequency. Are you familiar with that? Yeah. Electromagnetic frequency. Yeah, right. So a lot of people don't realize, they know about the fact that you're not supposed to sleep next to your phone because it's harmful. They don't realize that EMFs are everywhere. And when you pick up your phone, when you have metals in your mouth, which is mercury, metal crowns, metal substructure or metal implants, the signal from the tower actually goes to the metal in the face first because it acts as an antenna. That's how strong it is. And then it bounces up to the phone. Okay. So if we have any metals as far as metal implants, metal crowns, gold, and anything like that, it's disrupting electricity up the grid dramatically every time that signal comes in. Okay. Yeah, people don't realize that. It's a huge antenna in the face. right? The body is not really meant to have metal inside the body biologically, but mercury, like I said, is a different animal. So when that EMF comes in and hits the mercury filling, double amount of mercury waves come off because of that electricity that hits it. Okay. And when you go to a dentist, like I did, and I had my own journey of thickness from mercury filling, is when they just tell us in dentistry, just drill on it, take it out, and if somebody wants to change it, just like a tooth. And that's what dentists do. And that's why there's a lot of dentists that have, illnesses that they don't really realize. You drill on it, and now 3,000 microns per minute of mercury comes off, and it's odorless, tasteless. If it touches the skin and hair, it gets absorbed into the body dramatically, right? Heavy metal toxicity from mercury, it resides in the thyroid, it resides in the pituitary gland, and then when it gets into the blood, the way your body reacts and wants to clean up the blood, it pulls it into the organ. So there's a lot of organ dysfunction because of mercury and heavy metals, which everybody knows heavy metals are not good for you. And so, yeah, that's a big problem.
The thyroid cancer 7 years ago, and the lymph nodes affected were on the same side as my filling. I wonder if that's a corroboration there.
Well, a lot of things cause that. And it's great that you brought that up because, like I said, in biological dentistry, we use a tool called a cone beam CT scan. Have you heard of that before?
What kind of CT scan?
It's called a cone beam CT scan, which is a specific CT scan that just for the face, for the oral cavity, right? And because when you use two-dimensional x-rays, like, when you go to a dentist and just take some small x-rays, that's just really for cavities. You can't really see hidden infections. So a cone beam CT scan is a machine that you go in there and kind of scans your whole head. And on that CT scan, which is a three-dimensional scan, we can see a lot of things, what's going on in the jaw, right? We can look at, root canals are infected and are leaking that are hidden, which cause a lot of systemic problems. We can look at like what's going on underneath the fillings. We can see in the jawbone if there's any defects. They're called cavitations that are leaking bacteria. Sinus infections. So yeah, there's a lot of hidden infections that cause oral systemic problems, cancers, autoimmune issues. Because think about it, the mouth is a gateway to the body, right?
Also, too, the blood supply is, with teeth, you brush your teeth, your gums may bleed, etc. So not only is your mouth a gateway, but the gums, if you bleed at all, I would think that's an instant gateway into your bloodstream too.
Yes, of course. But that's already even conventional dentistry. Now they've kind of linked that together. If you have gum disease, the same anaerobic bacteria that's in the gums is the same anaerobic bacteria they find in the heart. So it's very connected. Gum disease and heart disease is very interconnected in conventional dentistry. So that's something that we all agree on. So 100% you're right about that. So if you have gum disease, that will lead to heart disease. Okay. So the oral microbiome has to be very balanced and healthy to be able to have a good microbiome, gut microbiome, which is the brain, right? So if you have bad bacteria in the mouth, it will lead to the stomach. And you got to have bad microbiome in the gut, which causes, autoimmune issues, a lot of systemic. So yeah, you're right. These are valid points. These are all issues that you have to kind of look at and see where it's coming.
All right. So we talked about this kind of filling. So I don't think they do mercury fillings anymore. They do more, I don't even know what they put in them, but like today's dentistry, what do they use? Oh, they do.
American Dental Association, our country is still very behind. Think of it this way: in Russia, they banned mercury fillings in 1972 because it was too toxic. And in the United States, they still allow it. You still, you have to have informed consent that is toxic, adds mercury and all that, but they still allow people to put them in, which is shocking. But yeah, I've never used it since I've been practicing 30 years, but we have so much better materials, biocompatible materials like porcelain or zirconia that we use. At Smilebody, we created a wellness center basically here that we have biological dentistry with encompasses, we have about 8 doctors that are in the center. And then with functional medicine doctors, our holistic medical doctors are here with the IV center and, hyperbaric oxygen chambers and red light therapy. So we're putting everybody through the healing modality, starting with the mouth. And then if that medical issues, a lot of people have brain fog, gut issues, the thing is, it's just one body. The way that you're treating it right now is, like I said, your head's cut off from your body. They're not interconnected. So that's why we created Smilebody. And now this encompasses a space that people fly in, like I said, nationally from all over the country right now. Like I was just mentioning, someone was here from Texas, and we just put him through the healing modality. We look at the oral cavity first, make sure there's no hidden infections, no mercury, no metals, and there's something called cavitations where your wisdom teeth were taken out and it becomes a hole in the jaw that people don't know that harvests parasites and, bacteria in there, and it causes all those problems. So we look at all this.
So, all right. So when a patient comes in, do you do regular cleanings and stuff, or are they only coming to you because they have like serious dental problems that no one else is addressing?
No. Here, so this is a center. It's about 7,000 square feet that we created, Smilebody. So we have all providers here. So we have 6 dental hygienists in the practice that are going through all of what you talked about, looking at the gum health, looking at the bone health. We look at sleep apnea. We're both, Ben and I, are sleep apnea specialists. So this is a hidden silent killer that nobody looks at. There, we look at airway. We have machines from Harvard that we look at the back of the throat, and we kind of tell if, and our doctors, our medical doctors in the office can do sleep studies and see if the patient is suffering from sleep apnea. So these are all airway issues and oral issues, right? And then from there, if they have cavities, obviously we have biological general dentists that are doing tape removal of mercury, because mercury, like I said, when you drill on it, causes a lot of issues. So per the academy, there's a certain way, like for instance, if you wanted to go take out your mercury filling, if they drill on it right now, you got to be exposed to a lot of mercury. And we have to do reports actually. So you kind of take a look at blood work and different kind of stuff and see how much mercury they have in the body or heavy metals. So the safe protocol is that we put you in a room, and it's called the SMART technique. The patient is covered with a plastic material all over their bodies to make sure there's no skin exposure, no hair exposure. Their oxygen is placed in your nose, so you're not getting exposed to mercury. And there's big vacuums next to your face. So when they're drilling on it, the mercury vapes flow into the vacuum and not sit on. Because like I mentioned, when it sit on your skin or hair, it gets absorbed into the body, right?
Right.
So
what let's be specific. What's a typical patient you get in? Do you deal with like a lot of diabetic? Do you deal with a lot of people that have apnea? Like, from an 80-20 perspective, what is like the biggest few problems that you deal with that go beyond just normal dentistry?
That's a great question. I mean, my degree is in dentistry, but to be honest with you now, because we're looking at the total body health, because it's one unit, most of our patients, like I said, they're flying in from out of state. And what happens is the doctors are referring them over, the functional medicine doctors, or we're doing telecalls on the computer to look at their CT scans and see if we see any kind of, infections in their jaw or, mercury fillings or the things that we talked about, sinus infections or cavitations and all that. Once we see something, we go over it with them on a CT scan, and we do a share screen and we show them the CT scan, and then they fly it. They come to the center, and that's the reason that we created Smilebody, because it's your mouth and your body. It's not separate. And then we basically do a full evaluation, and based on the toxicity level, if it's just like you said, if it's just gum issue, then we just treat the gum. But a lot of patients are coming in, they're trying to look for hidden infection, trying to see what is the mercury doing to them. What if they have teeth that are infected, like root canal teeth that nobody's finding, that it's a big issue, and that they have leakages all the time, they don't know about it.
What are some what just came to mind is like, let's say someone has like a high C-reactive protein, biomarker, and they just cannot get it to go lower. Could that be because, let's say, they have a hidden infection from a root canal or a filling or something, and that's doing it? Like, what are 100%? What are some examples?
To be honest with you, I flew to St. Louis, and I saw this gentleman, Dr. Simon Liu. He's a cancer specialist, and he tests meridians. I don't know if you know what meridians are, but these are electrical bands of the body that connects the organs to each other, like what acupuncturists do, right? And so he talks about the fact that most people that have cancers get some kind of a hidden infection in their mouth. So he goes, I cannot heal you until you go to a biological dentist and do a Colby's CT scan and make sure there's no teeth that are infected, there's no root canals that are infected, Mercury fillings have to be taken out. All the metals should be taken out. So you don't want anything that is going to be interrupting that meridians in the body, which is Eastern medicine with Western medicine together. And that, it's been there for a long time. And we have to kind of connect with each other and figure out exactly what's going on from the oral cavity. Once the oral cavity is clean and they know that there's no toxicity brewing down, it's like for you being in the shower and you're trying to towel off and the drips of water is coming down constantly. You can't dry off, right? So if the oral cavity is brewing toxicity down into the lymph nodes and to the mitochondria is going to get inflamed and it's going to become toxic. So you can go ahead and try to detox all you want. And people are right now, they're suffering a lot of autoimmune issues all the time. They're trying to detox their liver. They're trying to do this, they're trying to do that, and it's not working. So I always tell patients, check your mouth first. You want to see a biological dentist and check the mouth, and not just a regular dentist, because they're not going to be able to find on a two-dimensional x-ray. And they don't know what they're looking for exactly. It has to be someone that's knowledgeable in biological dentistry.
Yeah, I mean, from what I've noticed, go to the dentist, the hygienist does most of the work, and the dentist will come in. There's really almost no conversation. They do a few things, and they're like, bye, see you next, whatever. And they're on to the next person. Like, there's no evaluation really of what's going on. It seems like it's like they're just popping in, like, I don't know, just doing a couple things and leaving. There's really no discussion either of, it's just like this protocol. This is what we do, like robots, and there's no, again, discussion of anything.
There is unfortunately, that's what I mean. It's just like, it's very robotic and it's transactional and they're not really, unfortunately, I was guilty of it too at the beginning of my career. That's what they told you to do. Just get in there, clean the teeth, clean the tartar, maybe tell people to use some mouthwash. If there's a hole in the tooth, like a mechanic, patch up the hole. And as long as the patient's not complaining, they're not paying, you're good. But it doesn't work that way, if you really look at someone carefully and you get knowledgeable, that's why, in the last 30 years, I've taken so many conferences, so many residencies. I just love dentistry so much. You learn about airway. That's why I became, a diplomat specialist in 2015 in sleep apnea, because that's, what's going on in the mouth. That's the gateway. People are suffering. They can't sleep well. What's going on with the gums? What's going on with the teeth? Looking at a cone beam CT scan and see if there's hidden infections, which we find all the time, by the way. Sinus infections, bony infections, something called cavitations, like I said, where wisdom teeth were extracted. And, people are sick because of this, but no one's catching it because we're really behind in the way that we look at dentistry, and we're hoping that we're creating a movement with other biological dentists, actually internationally now, with Dr. Dome in Germany and here. And there's a group of us that are trying to create a standard for patients to really understand how you should really look at the oral cavity.
If I come and you evaluate me, let's say I have an infection and you clear it, is it enough for me to simply say, okay, thanks, and I just go back to my regular dentistry and I'm fine? Or do I need like an upgraded protocol? Like I got, I just turned 50. I got a periodontal cleaning, my first one like a year ago. Like what, there's really no mention of anything. You just like, oh, just go every 6 months or whatever. Like what do you do for different people? Let's say again, someone has diabetes or someone has old fillings or whatever. Like what's different?
Opinions on everybody obviously different. So, if you have gum disease, we go over what kind of toothbrush you're going to use, which I'm a big fan of, round electric toothbrushes and water picks. And if you probably notice, the hygienists all they talk about is flossing all the time. Right? You got to floss, which is great. You want to do that too. But water pick is great for gum disease. Like I noticed you mentioned gum disease a few times. Water picking, hydrogen peroxide in there a little bit 3 times a week will kill anaerobic bacteria really well, and your gums are going to really tighten up. Those are the basics, so we can eradicate gum infection very quickly, right? But which, like I said, will eventually spread to the heart. But what we're looking at, if they have mercury fillings, they come in to do the tape removal of mercury or any kind of metals to make sure that we open up the meridians, that there's no toxins in the body as far as metals go. And we use porcelain base. We have a laboratory on site here. So everything's fabricated here at Smilebody. And whether they need crowns or porcelain fillings or, whatever it may be. And it's delivered the same day, right? If there's teeth that have to come out, if we see infection, we take them out. We don't use metals like I talked about. So out there in the world, everybody, which I did as a implantologist, I used a lot of metal implants, right? That's probably all you've heard of, metal implants. But actually in our world, we use zirconia implants, which is a kind of, let's call it a dense porcelain-based material that basically is biocompatible. There's no metals. It doesn't pull any EMFs. And the meridians are open to go, the electricity to go through it. So these are all these little things that are very important to use to keep the body healthy, So for each different scenario, we have to kind of write a protocol of what we do.
Right. I know everyone's different. Every situation is different, all that stuff. What are some of the upgraded protocols if you're not in good shape and you're having problems? Again, let's say you're older, diabetes, whatever it is. What are some things you do? Do you clean more often? Do you do like yearly periodontal cleanings? Like what are some of the upgraded things that you could do for people?
So basically, for again, gum disease that you're mentioning, everybody's a little different, right? Like you're talking about, some people, they get, cleaning with lasers every 2 months, some people every 3 months. And there's a 2, 3, 4, and 6 month for if you're super healthy, you can get cleanings every 6 months. And then it goes up to 4 months, 3 months, and 2 months that are really bad. Trying to keep the teeth. We use lasers. We use something called ozone therapy, which is natural disinfectant with oxygen that eradicates anaerobic bacteria really well. And so we can get that bone health and the gum health back, right? So depending on how bad and how much bone loss they have, we go through that protocol and we write it up based on what we're looking at the CT scan, which on the CT scan, by the way, you can see really how much bone loss they have, 3-dimensional. Instead of just 2-dimensional X-ray, you can't see around it exactly what's going on. So, and then onward to everything else that we talked about, extractions, zirconia implants, safe removal of mercury. If there's sinus infections we have to address, whatever it may be, we write a protocol for that.
Okay, so you'll do imaging beyond just X-ray because the dentist, again, typically it's just X-rays. But what doesn't show up on X-rays where you have to do this additional imaging? You can't see the condition of the bone on the X-rays, or what else?
So dental X-rays are the ones that you get, like the visual small X-rays when you go to the dentist. Those are really good for cavity. Okay. So you can't really see sinus infections at all. So we have imagery that we see, like people have root canal infections or the tooth infected. And when you look at a 3-dimensional X-ray, because the sinuses are right above that area, it looks great. So like, oh, you look great. You have pain? No, looking good. You leave. Just like you said, it's in and out. It's very transactional. Are you doing good? Yeah, Rich, you're fine? Fine. Thank you. The problem is when you look on a 3D cone beam, you find a lot of leakages from these root canals or dead teeth. Sometimes when they have big cavities and the tooth has died out and the sinuses are full of infection, right? No one's fighting. It's just hidden infection. You can't find it. So to answer your question, you can't see those on a regular dental X-ray. You can't. Okay. Doesn't show at all because it's too far up and the imagery doesn't show sinus infection. It's not for that. It's only for teeth, right? Or on the bottom, there's something called cavitation, or top, where your wisdom teeth were taken out. They just slowly take out the wisdom teeth out and put some stitches. You're going to be chipmunk for a little bit and then you're fine, and you're fine normally, right? Just, you have no pain. You're doing good. The problem is a lot of people don't heal well properly at that age, because in our teens and 20s, we're basically micronutrient deficient. So we don't have, which means we don't have enough vitamin D, magnesium, zinc, and K2 to pull calcium from your blood into those surgical areas. And so that area becomes like a dead bone space internally. It becomes like an hollow space, which is called a cavitation. You probably never heard of it before. And bacteria resides in there, parasites, heavy metals. They just go in this little cave and hide it, right? And that causes a lot of systemic toxins being released in the body.
What about if you're a nose breather or a mouth breather? Like a nose breather, I would think you'd have more of an anaerobic environment in the mouth. And if you're a mouth breather, you have a more of an aerobic environment and you would attract different microbiomes over time. And that would change the acidity and the chemistry of your mouth quite a bit. Can you tell if someone's like a mouth breather or a nose breather just by looking at their teeth and everything?
That's not the significant thing. It's very important for you to breathe from your nose because nitric oxide gets produced when you breathe from your nose. Okay. And when you're a mouth breather, your microbiome becomes drier in that sense, and your microbiome changes. So you want to make sure that you breathe from your nose. You do not want to, you see now there's mouth tapes and all that kind of stuff, or in my specialty, because, I'm a sleep apnea specialist as well, we make oral appliance therapy for patients that, to make sure the sleep apnea is better. So they're breathing from their nose. not from their mouth, or sometimes we get ENTs involved. If you have deviated septum, they can't breathe well. You have to breathe from your nose, because what happens is sleep apnea, which, if you're only mouth breathing and you're not breathing from your nose, you're not producing enough nitric oxide, which causes high blood pressure, because, you need nitric oxide to be able to have that vascularity in the arteries. They harden up and you get high blood pressure. So there's a lot of comorbidities that happen with sleep apnea that are silent, but so you have to breathe from your nose. Mouth breathing, that's part of it that you were mentioning, that changes the microbiome of the mouth, that becomes drier, more acidic. But the most important thing is the medical aspect of it, which is the nitric oxide production from the nose.
I know that some like CPAP still entrain the humidified air in them so that the mouth doesn't dry out, when you're using it at night. Are there any CPAPs or like nose cannulas you could use that entrain a bit of nitric oxide so that you can, get the benefit of that all night? Has anyone done that?
Well, the thing is that CPAPs are fantastic. BiPAP, CPAP, all that for the gold standard for a long time. Nowadays,
I know they're fantastic. Some people feel like they can't breathe and you got to adjust the pressures, and sometimes the mask gets torn off and blah, 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 blah.
When you say fantastic is, you're right about that. When I say fantastic is, at least we're pushing air into the body, because CPAP is a silent killer, which eventually, as you get older, I can go through the comorbidities with you, but eventually stroke and heart attack for elderly patients because they can't break out of it. So in that sense,
What I worry about though with CPAP is like, I don't know if it's urban legends, but if you use one and for some reason you don't use it one night after you've used it for a while, people die. I don't know if it's true, but if your body gets used to the CPAP, let's say the battery dies, you're traveling or who knows, and you don't have it and you try to sleep, could it kill you? Because again, you're used to it and now your body doesn't have it one night.
No, it's not about getting used to it. It's about the fact so let's go back up for a minute. So sleep apnea, just so you know what that means, is that it's choking patterns of the jaw, because the pharyngeal muscles of the neck are not opening and closing more than 10 seconds. That's when people do sleep studies. And if it comes back from a board certified neurologist and indicates you have sleep study, we look at how many choking patterns are happening per night. So like 15 chokes per minute is about, per hour is about mild apnea. Up to 30 is moderate apnea, and anything 30 chokes or more per hour is about severe apnea. So what you're referring to is someone that has like severe apnea and, they're putting them on a CPAP, is pushing air, right? So now if you take it off and they don't wear it, they're going to have those episodes of choking patterns again, which is going to be very dangerous. That's the whole point. They could have stroke, heart attack. So the CPAP, it's not that they're getting used to the CPAP. The CPAP is helping them push air that they don't have the choke.
Well, what if I've been using one for a year and then, like I said, something happens, I can't use one for a night?
So people suffer because now they're going back to the choking patterns. So now, just what I was going to refer to, we use two things. Like a lot of times for doctors, they use CPAPs, and we use a lot of times for mild to moderate, we use oral appliance therapy, which is an appliance that brings the jaw forward a little bit and keeps the airway open. These are the only two devices that are FDA approved for sleep apnea that we can use. And so I, Gilliver, as a sleep apnea diplomat, I use a lot of oral appliance therapy. So once it's diagnosed by ND and we know that sleep apnea, they refer to us and we make him an oral appliance therapy that moves the mandible forward, keeps the airway open. Now that's something which I had apnea myself, by the way. I was diagnosed 7 years ago. I wear that much. But what happens is that people can travel with it, right? Just like you said, it's a small appliance. You can travel with it. You don't have to carry this big mask and tubing and machines. You want to travel with this guy. It's very hard, right? So oral appliance therapy, a lot of people don't know about it. It's fantastic. There's academies out there that for sleep that train people like I was, and so you can make it for a sleep patient to be able to sleep.
So it was a tricky to get used to it. I remember there was like a product called Snore RX. It wasn't as good as a dentist, but you go and you boil it, you put it in your mouth, and it molds to your mouth supposedly, and you sleep it.
These are not good. We're not talking about that kind of stuff. We're talking this were horrible stuff. We're talking about a medical grade in a medical lab. They have to fabricate something to scan the mouth We measure exactly how much it has to be opened up exactly. And then we have a laboratory has to fabricate that. It takes about 3 weeks. And it comes back and it's custom made for your mouth, right? And it's very small. It's a very thin, small, to answer your question, it takes about one night to get used to it. And not only that, but it takes about one night to start to be able to breathe better. Because whenever I deliver this, patients always ask me, well, how long will it take for me to get better? Immediately. Why? Because your airways opened up right away.
But is it also low profile enough where it doesn't feel like a mouth guard and make your lips bulge out or chafe against your gums while you sleep? Like, how thin and low profile are they now? You don't have this huge hunk of plastic in your mouth when you're trying to sleep, you know?
Again, like I said, I mean, I've been using it for 7 years. I deliver about 40, 50 of them a month. To be honest with you, everyone's really happy because they're sleeping better. Thus, when they get up in the morning, they're not burning out in the afternoon. And a lot of, like I said, a lot of other comorbidities that's caused from sleep apnea, ED. You know, like I said, for our senior patients, you know, stroke victims, we see them after the stroke victim. So they're just happy that they can sleep better, right? And so no one's really complaining about it's too big. It's not big. It's a very tiny little, you know, appliance that they put in their mouth. But this diet is so much better as far as getting airway, you know, and oxygen into your body. Yeah. So it's really cool. So there's two options with that. It's, you know, CPAP, BiPAP, like I said, it's great. But the problem is a lot of people can't wear it. You know, they just tell me, they come in, I talk Shawn. No, I'm not going to wear this. I'm sorry. You know, and you're
Decide why don't they want to wear it? Why?
comfortable. There are a lot of people that they don't like the mask on their face. They don't like the tubing. They don't like the machine next to them, you know, sitting there making noise, some of them, and pushing air into your body. They're just uncomfortable. They get bloating, you know, that kind of stuff. And everyone's different. You know, so some people we have that they work well, but they did a study that a lot of people after 6 months, they fail on CPAPs and BiPAP because they just don't like to wear it. It wraps around their head, they're moving around, they wake up, that kind of stuff.
Well, I mean, how well is it tolerated by most people?
I don't know. I just relate.
Well, is the oral appliance tolerated better than a CPAP or a BiPAP?
Well, the oral appliance is different because it's such a small little thing that you put in your mouth.
Right, but it does the job, but is it tolerated better by people? Do you have less complaints, less people saying, yeah, I'm using it, and they're lying because they just don't want to use it, you know?
Well, most of the people that I see are referred by MDs that are either claustrophobic, they don't like the tubing, they want to travel a lot. They're like, I can't travel put this in a suitcase every time when I'm traveling. Or, you know, they just want something light so they can get oxygen and they don't have to use the CPAP.
Okay, but you're saying again, with the appliances, a lot higher percentage of people are okay with it. 100%. Okay, no, that's great. Are there any other devices that coming or that, you know, are in use?
You know, to be honest with you, these two units that like the CPAP, BiPAP, and the oral appliance therapy has been around for so long now that we have proven science. I did my residency at UCLA for sleep, but you know, there's things that are coming out. You know, we're going to put underneath your skin, and there's not enough, you know, study on it long term. So I never like to use things that are just new out. You have to look at the study and the research behind it, and have patients use it for, you know, at least 5 or 7 years to figure out exactly what's working. So to answer your question, no, not really. These are the two that we're still using.
No, that's fine. You know, again, as long as they work, that's great. Okay. Well, very good. We're at the top of the hour, so we do have to go, but what's the best place for people to find out more about your clinic? And do they need a referral from their dentist, or can they mention to their dentist, like, hey, you know, I want to, you know, Dr. Javid to look at my issue? Like, how can people get in touch? What's the best way?
Well, they can definitely find out my Smilebody.com, and that's our Instagram also, my Smilebody, at my Smilebody. And that's the wellness center that I told you about that we have in Los Angeles. And basically, yeah, we created a space that's very safe. And we have, you know, like I said, medical doctors and biological dentists, functional medicine, and IV center and hyperbarics, everything in one center. So because like it's just like what we just talked about, the sleep, there's so many different aspects we didn't get a chance to talk about that people are suffering. We're just trying to cash everything, whatever your problem. And that's why we created Smilebody. But yeah, if you go to my Smilebody, they can find it for sure.
Okay, very good. Well, Dr. Javid, thank you so much for coming. And it sounds like we got to have you back soon to talk more about the different things that you've seen, but I appreciate it.
Thank you, Rich. I appreciate your time. Thank you for having me today.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.